My name is Nikki Garcia, and I am a physical therapist for the Toronto Raptors, and I am also a Western alumni in the Masters of Physical Therapy program and the Sport and Exercise Medicine program. So as a physical therapist, I am there to assess injuries, provide acute care management, as well as all of the day-to-day needs of the athlete. So it's a full-time job. I travel with them to every game. I'm there for every practice, for anything you can think of. You see them on TV, I'm there. So it's a lot, it's demanding, but it's a lot of fun. Physiotherapists play a key role in the team's performance because we help with their availability. The number one way to win is to have the players available. If a guy is not available, especially if they're the star player, we might not perform well. If it's a long-term injury, then we just make sure that they're feeling nice and recovered so that they can go back on court the next day. So when I started working in professional sports, I started to realize how specialized this field is, and part of me missed seeing a more broad scope of patients, and I found if I stayed in this field long enough, my scope of practice can get really small and narrow and very specialized because I'll only be seeing professional basketball players. And this program allows to keep my scope of knowledge broad, and it just helped to develop my own personal skills and keep the doors open. So I'm trying to think of the big picture and help with the continuing education because I like being a lifelong learner, and the structure of the program suited my preferences. So they, at the time, had a lot of coursework in the beginning. It was front-loaded coursework, and then the back half was all placements. And for me, that's just kind of what I found to be very helpful. And they had a really good reputation in the medicine field, so I just thought it would be a great school and fit for me. With the mentorship, how it works is that they connect you with a sport and exercise medicine specialist who's probably done this program before or who has had proper education in advanced healthcare practice, and they're a resource for you for when you don't know what's going on, or if you have any questions, basically be a soundboard and bounce some ideas back and forth. So the mentorship and connection is actually really good because you find when you go out into practice, it's hard to find mentors. So the program, as it connects you to these mentors who are obviously educated and well-informed, especially with the research portion, is a huge advantage of the program is because of that just network of mentors. So a lot of our programs are intermixed with the physicians in our class. Every week there would be different discussion forums, and your group was always mixed depending on the week. So sometimes I'll be primarily with physiotherapists, other times I'll have some of the docs, and it's very interesting to see how there's different approaches to the same athlete. In sports, it's a lot of collaboration and multidisciplinary teamwork, so it's nice to be able to collaborate and see how other people think, because that might not be the way that I would normally think. And then it just, again, makes you a better clinician because you have that broader mindset. So throughout the year, we have lectures on certain topics, and then we'll get together during the residency just to consolidate what we learned. So this is where we're practicing hands-on techniques. What's nice about the campus here is there's a lot of different resources available. So we went to the exercise physiology lab, went to the WABO there, where you can actually watch some data tracking and how they assess joint movements through the markers. So the in-person really just helps to ensure the information that you learned online is applicable in real life. I think the advice I would give to students coming into the sport and exercise medicine program is you get what you put into it. The amount that you're going to learn and how much you're going to grow as a clinician and as a person is really going to be dependent on how you address these online modules. What people are looking for in professional sports and in these higher level positions is that you have the knowledge and you have the experience in this field. So being able to get your feet wet and in the door in sport and exercise medicine programs and internships, they want to see that you've done the work. And so a program like this is really going to stand out on your resume.